Well, here we are. It's fall 2020, and test, test, test. Everyone has been asked to get tests to come in, tests to go out. And so that's what we're going to talk about today, the value of these tests. So there are basically three types of tests, and we all are pretty familiar with the PCR test or the nasal swab when they go way up into the nose. Now that test has been the gold standard, and basically when they do the PCR test, what they're testing for is the DNA of the virus, the RNA. And so they're actually getting a piece of the genetic material of the virus. So that's a pretty accurate test. And when we talk about tests, we have to talk about sensitivity and specificity. And these are really important kind of concepts, and they can be a little hard to grasp. I'm going to try to explain them in a very straightforward way. And so if a test has a high sensitivity, then let's say that we have 100 people and 100 people are positive for COVID-19. Well, the PCR test, if it is 98% sensitive, it will pick up 98 of those people. So there's about two people that will actually be positive, but they'll come up negative. So they would be like false negatives. So again, the sensitivity tells you those people that are taking a test that are positive for that test. So we want a test that's high sensitivity, that has a high percentage. And 98% sensitivity tells you that everybody that's positive in that group, you're going to get 98% of true positives. But there's that 2% that could still be positive, but they come up negative. And so we want high sensitivity. So when we talk about all of these different tests, we're talking about these labs are taking into consideration the accuracy of the test. The other thing is the specificity of the test. So when you talk about how good the test is, you talk about sensitivity, specificity. Specificity tells you that the negatives, in this case, the negative cases. So if you have 100 people and they're all negative, and your specificity is 98%, it's gonna identify 98 of those negatives. There's going to be 2 of the negatives that are going to read positive. So those are going to be false positives. So again, we can see that we want a test that's going to be high sensitivity, high specificity. So we will know if a person reads positive, they really are positive. It's nothing false about their reading or anything like that. And of course, when this first came, when the pandemic first started, the FDA didn't quite have enough time to look at all these tests and make sure that the sensitivity and specificity of the company was what it really was saying that it was. They didn't have time to cross-check and check because things were happening so fast. When we talk about the PCR, the nasal swab, that's a pretty good test. The sensitivity of that test is in the 90s. It's in the 90s, and of course it all depends on the manufacturer of that test. But most manufacturers of that test, the test is in the 90s. So, but the PCR test, it's expensive. It has to be, in most cases, sent to a laboratory. You have a reagents, you have the chemicals that has to be mixed up in, mixed together with. There's a lot of steps and a lot of materials that you need for the PCR. And so and it takes a few days to get the results back. In a lot of cases, by the time you get the results back to the patient, if they were positive, they have spread the virus to it could be several hundred people if it takes 5 to 6 days to get the results back. So you can see where there was the need for a quicker, faster test, like within 15-20 minutes, are you positive, are you negative? So there's the second kind of test I'm going to talk about. It tests for proteins of the virus. The sensitivity of the test and the specificity of the antigen, it's an antigen test. The PCR, the nasal swab, is a genetic test. So the antigen test, the rapid test, it tests for the antigen. You can get your results within 15 minutes, 15-20 minutes. When President Trump was being tested and our own governor here in Ohio was being tested, you heard there was some talk about a rapid test, and I'm sure that people were thinking, well, is that a different test than the nasal swab? Because I had to wait 5 to 6 days. So that was the antigen test. And so I think that's the value of having that antigen test, where you can get the results quickly. But you may think, oh, I have COVID-19. Well, if you have that rapid test, which the accuracy of that, sensitivity and specificity, is pretty high. At least the one that I looked at, Abbott Labs has one out that has a pretty high, is pretty accurate. But it hasn't gotten down to the point where you can go and purchase it. It has to be done at a doctor's office or the hospital, the emergency room, urgent care, those kinds of places. One of the ways one of the things that it's going to take to get a real grasp on this pandemic is where people can do that test at home before they, brush your teeth, out of the shower, and you take that quick test and you say, oh, I'm negative, I'm still negative. These symptoms I have are cold symptoms. So PCR, genetic test, antigen test, the rapid test, the antigen test, and then there's a third test, and we talked about it on one of our previous videos, and that is the antibody test. Whenever our bodies are invaded by a foreign substance, in this case a virus, it produces antibodies. And so to fight off the virus, it produces antibodies. You can go back once a person has the symptoms, they test positive either by the PCR or the rapid antigen test. You can now go back and check their blood and see what their response was in terms of their antibody concentration. Did they produce a significant amount of antibody? It's possible that they didn't produce any antibody. Their bodies couldn't produce antibody. So those kinds of things are important in terms of epidemiology. As we look back on groups and communities of people, that antibody test becomes important. And just because you have antibodies doesn't mean that your immunity is at a point where you can no longer be infected, because we know there's reinfection now for this coronavirus. We also know that it has mutated. There's over 100 different types of mutations for this coronavirus. The antibody test can be important, though. It can be important because it can give us information about your immune system and how you responded to the virus. All that being said, we still want to wear our mask, social distancing, washing our hands, and all of the things that we know that have been really encouraged for us to do. We want to do those things while science is trying to bring this thing to a halt. So if you like this video and you want more information, hit the like button, subscribe to this channel, and we'll give you more information. Thank you. We'll see you next week.